Welcome back to NCLEX Made Easy 91. Today, we're diving into one of the most vital areas of nursing, midwifery and maternity care. These 50 high-yield, exam-tested NCLEX questions will challenge your critical thinking and sharpen your understanding of labor, delivery, and postpartum nursing. Whether you're preparing for the NCLEX, NMC, or any nursing board exam, this session will push you closer to success. Stay focused, think like a nurse, and let's see how many you can get right. Remember, each question comes with answers, rationales, and smart strategies to help you master every topic. Ready? Let's begin. Question 1. A woman in active labor reports severe back pain with each contraction. The fetus is in an occiput posterior position. Which nursing intervention is most effective? A. Encourage deep chest breathing. B. Apply firm pressure to the lower back. C. Elevate the head of the bed. D. Turn the client to a supine position. Answer, B. Rationale, counter pressure relieves the intense back pain from fetal occiput posterior position. Strategy, focus on pain location, back pain points to posterior fetal position. Question 2. During the third stage of labor, the nurse notices a sudden gush of dark blood and the umbilical cord lengthening. What should the nurse do first? A. Apply fundal pressure. B. Massage the uterus. C. Note the time and continue observation. D. Pull gently on the cord. Answer, C. Rationale, these are normal signs of placental separation, document and prepare for delivery of placenta. Strategy, know normal versus abnormal third stage findings. Question 3. A multigravida at 36 weeks reports painless vaginal bleeding. The nurse should A. Perform a vaginal exam. B. Place her in Trendelenburg position. C. Prepare for ultrasound evaluation. D. Start oxytocin infusion. Answer, C. Rationale, painless bleeding at 36 weeks suggests placenta previa, vaginal exam contraindicated. Strategy, painless bleeding equals placenta previa. Question 4. A primigravida at 8 cm dilation screams she needs to push. The nurse should A. Encourage pushing with contractions. B. Assess for crowning. C. Instruct her to pant and blow. D. Notify provider immediately. Answer, C. Rationale, panting prevents premature pushing and cervical trauma. Strategy, if cervix not fully dilated discourage pushing. Question 5. A nurse notes fetal bradycardia after a contraction. Which intervention is first? A. Turn the client to her left side. B. Administer oxygen at 10 liters per minute. C. Stop oxytocin infusion. D. Notify the physician. Answer, A. Rationale, repositioning improves placental perfusion. Strategy, position changes usually come before oxygen or meds in fetal distress. Question 6. The nurse assists with amniotomy. Which finding should be reported immediately? A. Clear fluid. B. Greenish fluid. C. Straw-colored fluid. D. Bloody fluid. Answer, B. Rationale, meconium-stained fluid may indicate fetal distress or hypoxia. Strategy, always associate green fluid equals fetal distress. Question 7. After delivery, a nurse notes a firm uterus but continued bright red bleeding. What is the likely cause? A. Uterine atony. B. Retained placental fragments. C. Cervical laceration. D. Uterine rupture. Answer, C. Rationale, bright red bleeding with firm fundus indicates laceration. Strategy, firm uterus equals look beyond atony. Question 8. A woman in early labor is anxious and requests pain medication. The best nursing response is A. You can't have pain medication until you're in active labor. B. Let's discuss non-pharmacologic methods first. C. I'll ask the provider to evaluate you for medication. D. It's too early for pain control. Answer, C. Rationale, assessment and provider evaluation precede analgesia. Strategy, always assess before medicating. Question 9. A client in labor has variable decelerations on FHR tracing. The nurse should A. Administer oxygen. B. Reposition the mother. C. Increase 4 fluids. D. Prepare for cesarean section. Answer, B. Rationale, cord compression causes variable decels, position change relieves pressure. Strategy, variable equals cord problem equals reposition. Question 10. During postpartum assessment, the fundus is boggy and deviated to the right. What is the cause? A. Uterine rupture. B. Bladder distension. C. Retained placenta. D. Hemorrhage. Answer, B. Rationale, full bladder displaces the uterus and prevents contraction. Strategy, always check bladder first in uterine atony. Question 11. A woman on magnesium sulfate shows decreased reflexes and respirations at 10 per minute. The nurse should A. Stop the infusion. B. Administer oxytocin. C. Lower the dose. D. Continue and monitor. Answer, A. Rationale, signs of magnesium toxicity require immediate discontinuation and antidote, calcium gluconate. Strategy, recognize magnesium toxicity, RR, reflexes. Question 12. A newborn is delivered by a mother with preeclampsia. Which finding needs immediate attention? A. Jitteriness. B. Blood glucose 55 mg per deciliter. C. Apgar 8 at 5 minutes. D. Heart rate 150 bpm. Answer, A. Rationale, jitteriness suggests hypoglycemia or hypocalcemia, common in infants of pre-eclamptic mothers. Strategy, jitteriness equals early warning sign. Question 13. A nurse notes umbilical cord prolapse during vaginal exam. The first action is to A. Push the cord gently back. B. Elevate the presenting part. C. Prepare for emergency cesarean. D. Apply oxygen. Answer, B. Rationale, relieves compression while preparations are made. Strategy, relieve pressure first then call for help. Question 14. A postpartum client complains of severe perineal pain and pressure 3 hours after delivery. Fundus firm, no excessive bleeding. The nurse suspects A. Uterine atony. B. Hematoma formation. C. Endometritis. D. Retained placenta. Answer, B. Rationale, localized pain and pressure indicate hematoma. Strategy, pain without bleeding equals suspect hematoma. Question 15. Which finding in the first postpartum hour requires immediate intervention? A. Saturating one pad in 15 minutes. B. Small clots. C. Mild after pains. D. Fundus midline and firm. Answer, A. Rationale, indicates possible postpartum hemorrhage. Strategy, no critical bleeding thresholds. Question 16. Which action is correct when performing Leopold's maneuvers? A. Client sits upright. B. Palpate with fingertips only. C. Ask client to empty bladder first. D. Apply firm downward pressure. Answer, C. Rationale, full bladder interferes with accuracy. Strategy, bladder empty equals accurate palpation. Question 17. A laboring client receiving oxytocin has contractions every 1 minute lasting 90 seconds. The nurse's priority. A. Decrease 4 rate. B. Stop infusion. C. Administer oxygen. D. Document findings. Answer, B. Rationale, contractions too frequent uterine hyperstimulation fetal distress. Strategy, recognize tachysystole pattern. Question 18. The nurse identifies late decelerations. Which cause is most likely? A. Umbilical cord compression. B. Maternal hypotension. C. Placental insufficiency. D. Head compression. Answer, C. Rationale, late D cells equals uteroplacental insufficiency. Strategy, late equals placenta problem. Question 19. A postpartum woman experiences chills and fever 2 days after delivery. What is the likely cause? A. Milk production. B. Endometritis. C. Bladder infection. D. Normal response. Answer, B. Rationale, postpartum uterine infection commonly appears after 48 hours. Strategy, fever after 24 hours equals infection sign. Question 20. A client in early pregnancy complains of morning sickness. The best dietary advice. A. Eat large meals 3 times daily. B. Avoid fluids during the day. C. Eat dry crackers before rising. D. Increase caffeine intake. Answer, C. Rationale, dry foods before rising reduce nausea. Strategy, simple, bland foods early morning. Question 21. A nurse prepares to administer betamethasone to a woman at 32 weeks in preterm labor. The purpose of this medication is to A. Stop uterine contractions. B. Enhance fetal lung maturity. C. Control maternal blood pressure. D. Reduce infection risk. Answer, B. Rationale, betamethasone stimulates surfactant production to prevent respiratory distress syndrome. Strategy, steroid before preterm birth equals lung maturity. Question 22. A postpartum mother who delivered 12 hours ago complains of burning on urination. What should the nurse suspect? A. Normal postpartum changes. B. UTI. C. Perineal healing. D. Retained urine. Answer, B. Rationale, dysuria after birth commonly indicates urinary tract infection. Strategy, always assess for infection if burning noted. Question 23. During a home visit, the nurse observes the newborn has yellow skin extending to the chest at day 3. What is the appropriate action? A. Reassure the mother this is normal. B. Encourage frequent breastfeeding. C. Report possible pathological jaundice. D. Stop breastfeeding temporarily. Answer, B. Rationale, physiologic jaundice is normal, frequent feeding enhances bilirubin excretion. Strategy, yellow skin chest level equals normal if after 24 hours. Question 24. Which assessment finding indicates the need to withhold oxytocin infusion? A. Contractions lasting 60 seconds. B. Fetal heart rate 110 bpm. C. Contractions every 90 seconds. D. Uterine resting tone firm between contractions. Answer, C. Rationale, contractions too frequent fetal compromise risk. Strategy, safety before stimulation. Question 25. A nurse caring for a postpartum client observes a foul-smelling lochia. The nurse should A. Reassure the client this is expected. B. Encourage increased activity. C. Notify the provider. D. Apply warm compress. Answer, C. Rationale, foul odor indicates infection. Strategy, odor equals infection flag. Question 26. A woman at 10 weeks complains of light spotting after intercourse. The nurse should A. Tell her to avoid intercourse until bleeding stops. B. Instruct her to go to the ER. C. Administer Rogam immediately. D. Schedule an ultrasound. Answer, A. Rationale, cervical irritation in early pregnancy can cause spotting, rest is advised. Strategy, mild spotting equals temporary abstinence. Question 27. A woman in transition phase yells that she can't do it anymore. The best nursing response is A. You're almost there, keep going. B. You must calm down. C. Would you like medication? D. Let's try a slow breathing pattern together. Answer, D. Rationale, coaching breathing helps her regain control. Strategy, emotional support and focused breathing. Question 28. The nurse notes the uterus is firm but fundal height above the umbilicus 24 hours postpartum. What is the cause? A. Uterine atony. B. Full bladder. C. Retained placenta. D. Infection. Answer, B. Rationale, a full bladder elevates and displaces the fundus. Strategy, first nursing action, assist to void. Question 29. A pregnant woman with severe nausea and vomiting shows ketones in urine. This indicates A. Normal dehydration. B. Excess protein intake. C. Starvation ketosis, hyperemesis gravidarum. D. Infection. Answer, C. Rationale, ketones signify fat breakdown due to prolonged vomiting. Strategy, recognize complication of hyperemesis. Question 30. The nurse identifies that the newborn of a diabetic mother is at risk for A. Hyperglycemia. B. Hypoglycemia. C. Hypothermia. D. Polycythemia. Answer, B. Rationale, maternal hyperglycemia, fetal hyperinsulinism, postnatal hypoglycemia. Strategy, always check glucose early. Question 31. Which finding requires immediate intervention in a laboring woman? A. Moderate variability. B. Early decelerations. C. Absent variability. D. Accelerations. Answer, C. Rationale, absent variability indicates severe fetal hypoxia. Strategy, variability equals best indicator of fetal oxygenation. Question 32. A nurse palpates the uterus and notes it's boggy. What should the nurse do first? A. Assess bladder fullness. B. Notify provider. C. Administer oxytocin. D. Massage the fundus. Answer, D. Rationale, first step in managing uterine atony is massage. Strategy, always massage first before calling MD. Question 33. Which action by a postpartum client indicates proper perineal care? A. Wiping back to front. B. Using hot water. C. Changing pads frequently. D. Avoiding cleansing. Answer, C. Rationale, frequent pad changes prevent infection. Strategy, hygiene equals infection prevention. Question 34. The nurse is caring for a client with ruptured membranes for 20 hours. Which is the highest priority? A. Check temperature. B. Assess pain level. C. Measure contractions. D. Encourage ambulation. Answer, A. Rationale, prolonged rupture infection risk, assess for fever. Strategy, think ruptured membranes equals infection risk. Question 35. A woman receiving epidural anesthesia suddenly develops hypotension. The first nursing action. A. Call anesthesia provider. B. Place her in left lateral position. C. Administer ephedrine. D. Increase 4 fluids. Answer, B. Rationale, position improves venous return and placental perfusion. Strategy, reposition before medication. Question 36. A client in postpartum day 2 reports breast engorgement. What should the nurse recommend? A. Tight bra and ice packs. B. Massage and frequent nursing. C. Pumping every 4 hours only. D. Avoid fluids. Answer, B. Rationale, engorgement relieved by frequent emptying and warm compress. Strategy, for breastfeeding mothers, use warmth and frequent feedings. Question 37. Which sign best indicates the placenta has completely separated? A. Boggy uterus. B. Gush of bright red blood. C. Cord shortens. D. Fundus rises and cord lengthens. Answer, D. Rationale, upward fundal movement and cord lengthening confirm separation. Strategy, memorize fundus rises plus cord lengthens equals placenta out. Question 38. The nurse notes a pregnant client has pica, craving non-food substances. The nurse should assess for A. Hypocalcemia. B. Iron deficiency anemia. C. Dehydration. D. Hyperglycemia. Answer, B. Rationale, pica commonly linked to iron deficiency. Strategy, abnormal cravings equals screen for anemia. Question 39. A client with preeclampsia reports visual disturbances. The nurse should A. Increase fluid intake. B. Prepare for magnesium sulfate. C. Encourage ambulation. D. Administer oxytocin. Answer, B. Rationale, visual changes indicate CNS irritability, magnesium prevents seizures. Strategy, warning sign seizure prevention. Question 40. A nurse notes the umbilical cord has only 2 vessels. Which condition is most likely? A. Normal finding. B. Cardiac or renal anomaly. C. Twin pregnancy. D. Preterm labor. Answer, B. Rationale, 2-vessel cords often correlate with congenital anomalies. Strategy, remember, normal equals 3 vessels. Question 41. A mother with Rh-negative blood delivers an Rh-positive baby. Which action is correct? A. Administer ROGAM within 72 hours. B. Repeat blood type test. C. Begin phototherapy. D. Give hepatitis vaccine. Answer, A. Rationale, prevents maternal sensitization. Strategy, always within 72 hours postpartum. Question 42. During labor, a nurse finds variable decelerations unresponsive to repositioning. Next action? A. Prepare for amnio infusion. B. Administer oxygen. C. Increase 4 fluids. D. Stop oxytocin. Answer, A. Rationale, amnio infusion relieves cord compression. Strategy, persistent variables equals fluid cushion. Question 43. A postpartum mother with mastitis asks if she can continue breastfeeding. The correct response. A. No, stop until the infection clears. B. Yes, unless abscess develops. C. Only on the unaffected breast. D. Express milk but don't feed baby. Answer, B. Rationale, breastfeeding helps drainage and is safe unless abscess forms. Strategy, mastitis is not equal to stop breastfeeding. Question 44. A nurse assessing a newborn finds cephalohematoma. The nurse understands. A. It crosses suture lines. B. It may increase bilirubin levels. C. It appears immediately after birth. D. It is caused by caput succedaneum. Answer, B. Rationale, breakdown of blood can cause jaundice. Strategy, cephalohematoma equals localized blood accumulation. Question 45. A woman with gestational diabetes asks why her baby may be large. The nurse explains. A. Maternal insulin causes growth. B. Fetal hyperinsulinism increases fat stores. C. Placental hormones limit oxygen. D. Excess amniotic fluid causes growth. Answer, B. Rationale, high maternal glucose fetal insulin macrosomia. Strategy, sugar equals size. Question 46. Which nursing measure prevents supine hypotension in late pregnancy? A. Elevate legs. B. Keep woman flat. C. Place wedge under right hip. D. Apply compression stockings. Answer, C. Rationale, shifts uterus off vena cava. Strategy, always tilt to left side. Question 47. A nurse notes lochia rubra persisting 10 days postpartum. What is most likely? A. Retained placental fragments. B. Normal involution. C. Infection. D. Healing perineum. Answer, A. Rationale, prolonged rubra equals incomplete involution. Strategy, duration of lochia matters more than amount. Question 48. A woman in active labor reports sudden chest pain and dyspnea after rupture of membranes. What should the nurse suspect? A. Pulmonary embolism. B. Amniotic fluid embolism. C. Anxiety attack. D. Pneumothorax. Answer, B. Rationale, classic sign, chest pain plus dyspnea plus collapse after ROM. Strategy, rare but deadly, act fast. Question 49. A postpartum woman reports urinary retention after delivery with epidural. The nurse should A. Encourage ambulation. B. Perform straight catheterization as prescribed. C. Apply warm compress to abdomen. D. Administer diuretic. Answer, B. Rationale, epidural may cause temporary bladder atony. Strategy, assist elimination to prevent complications. Question 50. A nurse teaching a woman about warning signs in pregnancy should include A. Mild back pain. B. Nausea in first trimester. C. Persistent headache and swelling. D. Occasional fatigue. Answer, C. Rationale, signs of preeclampsia needing urgent evaluation. Strategy, headache plus edema equals always assess further. Great job making it to the end. You just practiced 50 powerful NCLEX style questions on midwifery and maternity nursing, covering labor, delivery, complications, and postpartum care. Now, tell me in the comments. How many did you get correct? Which topic do you want next, pediatrics, OB drugs, or critical care? If this video helped you, like, share, and subscribe to NCLEX Made Easy 91 for more daily nursing prep content. Every question brings you one step closer to becoming a competent, licensed nurse. Until next time. Stay motivated, stay consistent, and keep learning with NCLEX Made Easy 91.